Good evening, I'm Judy Woodruff on the Newshour tonight. The virus on the rise. Cases of COVID-19 spike across the globe, forcing an end to many reopening efforts and further taxing healthcare resources. Then, an undue burden. The Supreme Court strikes down a Louisiana. That and more on tonight's PBS NewsHour.
Major funding for the PBS NewsHour has been provided by...
When the world gets complicated, a lot goes through your mind. With Fidelity Wealth Management, a dedicated advisor can tailor advice and recommendations to your life. That's Fidelity Wealth Management.
Consumer Cellular. Johnson & Johnson. Financial services firm Raymond James. The Chan Zuckerberg Initiative, working to build a more healthy, just, and inclusive future for everyone at czi.org. The William and Flora Hewlett Foundation, for more than 50 years advancing ideas and supporting institutions to promote a better world at hewlett.org. And with the ongoing support of these individuals and institutions. This program was made possible by the Corporation for Public Broadcasting and by contributions to your PBS station from viewers like you. Thank you.
The coronavirus pandemic has claimed the lives of some 503,000 people around the globe to date. Over a quarter of those deaths are Americans. This comes as more than 30 states are reporting a rise in new infections and as more communities loosen restrictions and reopen their doors for business. But some state leaders are now having to rethink their plans or cancel them altogether to battle this summer surge. We'll talk with a healthcare leader shortly. In the day's other news, Chief Justice John Roberts joined the Supreme Court's 4 more liberal justices in striking down a Louisiana law that placed restrictions on doctors who perform abortions. We'll take a closer look at that decision after the news summary. The High Court also made it easier for President Trump to remove the head of the Consumer Financial Protection Bureau, but it separately declined to block federal executions that are scheduled to begin next month. Stocks soared today on Wall Street and recovered half of their losses from last week after a healthier than expected report on the housing market. The Dow Jones Industrial Average climbed 580 points to close at nearly 25,596. The Nasdaq rose 117 points and the S&P 500 added 44. The White House briefs.
This is the PBS NewsHour from WETA Studios in Washington and in the West from the Walter Cronkite School of Journalism at Arizona State University.
And the globe rethinking how to reopen. William Brangham has more.
That's right, Judy. The U.S., as you were saying before, is clearly struggling to contain this virus. I'm joined now by a man who has spent his career fighting viruses and disease. Dr. Thomas Frieden ran the Centers for Disease Control and Prevention from 2009 to 2017, and he's now the head of a global health initiative called Resolve to Save Lives. Dr. Frieden, good to have you back on. We are about 6 months into this ordeal. We've seen 2.5 million official cases. Over 125,000 Americans have died. When you look at where we started versus where we are today, what is your assessment of how we have done responding?
Well, the U.S. is clearly a laggard here. There are countries around the world that are getting their economies back because they were guided by public health. They communicated clearly. They fully supported public health. And unfortunately, we're paying the price of a response that wasn't nationally organized and not well implemented. So if you lean into a punch, you're going to get hit. And that's what's happening all over the South and in most or much of the country today. The numbers we're seeing in the US are high, but they're only part of the story. There are many, many more people who are getting this infection and who have not been tested. So the 40,000 cases that were diagnosed the other day are not all of them. This is creating a huge viral reservoir that's going to take months to deal with. And really, the truth is, if you look at what people are saying, most Americans get it. We need to do the 3 W's. Wear a mask, wash your hands, watch your distance. And government and public health need to scale up the box-it-in approach that we've been talking about for months. Test strategically. It's not a question of how many, it's whether you do it right. Isolate people well, contact trace, quarantine supportively. There are some tough questions to be asked, but there's so much more we need to be doing. There are parts of the US that are continuing to see progress. New York, New Jersey, Connecticut, seeing progress still, but at risk, because if any part of the US is having this kind of rapid increase, all parts of the US are at risk.
So if, as you say, the majority of the country does believe in the 3 W's, as you were laying out, and wants to stamp out the virus, how do we explain this several dozen states now seeing these dramatic spikes? What is going on in those states that is causing that?
I think what you saw was an approach that wasn't data-driven. A data-driven approach would not have closed for so long in so many places that didn't have COVID. It's like trying to catch a wave when you're surfing. If you go too early, you don't catch the wave. If you go too late, you get swamped. You have to do it just right. So in many parts of the US, you saw closings too soon and too long. Then they open just as it's increasing. And again, opening when it's increasing is just asking to get hit hard. So it's no surprise that you're seeing these big increases. Places like Arizona, where nearly 1 out of every 4 tests is positive. That's an extraordinarily high rate. And that indicates a real increase, not just an increase in testing. It's going to take a while. It means a lot more distancing, masks, hand washing, distance, but it also means that bars need to be closed in these areas. You can't do that safely. We've had many outbreaks related to bars. It means that indoor space, the more people together with the more crowding, the less ventilation, and the higher the rate of COVID in that area, the more chance for explosive spread.
We have been seeing several states that have opened up early, as you were describing, or reversing. Arizona just this evening is announcing that they're going to start closing bars down in response to the surge of cases there. But I want to ask you about one other issue that the president and the vice president have argued that the real reason we're seeing so many cases is because we're testing more. If you look more, you're going to find more. Is that a fair depiction of what's really going on?
That's simply wrong. As a scientist, as an epidemiologist, as a doctor, I can tell you when you look at the data, there are 1 or 2 states where you're seeing a lot more testing and a similar increase in cases. That's correct. Then it's really about more tests. But if you look Arizona, Texas, Florida, South Carolina in particular, and many others, the tests are either up or stable, but the percent positivity is increasing. And that's the key number, because that tells you that the rate of COVID in that community is increasing. This is not about increased tests. It's about increased spread of the virus.